All right, welcome again to the Path Data in HMIS office hours. This is an open format discussion, so your opportunity to ask any questions you have about the webinar that we held last week or general questions you have about entering in your path outcome data in HMIS, uploading that information or entering that information into PDX when it comes either progress report or annual report time. Hi, everyone. I'm Kristen Looper. I direct the Path Data Exchange for SAMHSA here at Policy Research Associates, and I'm joined by Alyssa Parrish, and I'll let Alyssa introduce herself.
Thanks, Kristen, and hi, everyone. Glad to see you again. My name is Alyssa Parrish, and I am a HUD provider with ICF. I'm just here to talk about PATH and HMIS connections and reporting.
All right, so you all can ask your questions via the Q&A pod. So just a heads up, this is informal. We don't have the webinar slides, but we do have, as you can see, ASL interpretation. If you'd like to listen in Spanish, you can choose the interpretation icon and select Spanish as your audio. And we have live captioning available that you can access by turning on the transcript in your Zoom controls as well. The Q&A pod in your Zoom toolbar will be where you can enter in your questions. We also got a lot of really great questions during the webinar last week. And so Alyssa and I picked a few that we wanted to kind of kick things off with and answer. So one, it would be in the recording, and two, you all would get to kind of hear that Q&A as well, because it may be something that is on your mind. So I'm going to start one off that is a real kind of basic question, but a really important one about whether or not SAMHSA requires a diagnosis or documentation of a diagnosis when determining path eligibility status and enrollment. The answer to that question is yes. So the path legislation, it specifies that the path program is specifically for individuals who are experiencing a serious mental illness or have a serious mental illness, or have a serious mental illness with a substance use disorder. So both. The serious mental illness must be there. It can't be substance use disorder only. And they are either homeless or at imminent risk of becoming homeless. So those two criteria. So this diagnosis of serious mental illness, it is required for all individuals who are enrolled. So when you're doing outreach, if you're observing signs of serious mental illness, you don't have any diagnostic criteria, you don't have any medical records, that's okay. And those outreach activities are fine based on that observation that you are having. However, when you go to enroll someone officially in the PATH program, you do need documentation. It doesn't have to come from you, the PATH provider, that diagnosis. So if you don't have access to a clinician to make that diagnosis now, that's fine. But you would need either hospital discharge paperwork, documentation from a Social Security disability benefits application, any other clinical record from a qualified diagnosing professional. So that really is important. And then some examples to provide of some SMIs that would be specifically included would be bipolar disorder, major depressive disorder, and schizophrenia. All right, so I think that's kind of enough on that one. I'll turn it over to Alyssa to cover one HMIS related.
Sure. So one of the ones that came up last week that I think we answered, but wanted to circle back to was the distinction between services and referrals, because I think one of the last questions that came in that we didn't get a chance to answer was services have to be provided by PATH funding, correct? Otherwise, they're referrals. And that is accurate. So even in a situation where a PATH provider is within an organization that provides a lot of different services, if the PATH enrolled client is being provided a service internal to that same organization that is not PATH funded, it is recorded as a referral. So any service that a client accesses with the help of the PATH provider that is not PATH funded would be recorded as a referral. The services are only recorded if they are as services if they are path funded services.
Great. Thanks, Lisa. All right, we're going to turn to a couple of questions that came in the chat, then we'll go back to some of our prepared Q&A. So this attendee asked, what's the official guidance regarding visibility of path enrollments in HMIS? Should the enrollment visibility in path be restricted to path only?
So this is a local decision based on your privacy policy that governs HMIS. Because the path data is in HMIS, it follows your HMIS policies and procedures. The 2004 data and technical standards are still the baseline standard that we're working from, especially as it relates to privacy policies. You also need to take into consideration any state, local privacy policies that may impact your specific HMIS data as well. But there isn't a specific guide around whether or not those enrollments should or should not be visible in your HMIS. Again, that would be governed by your local HMIS policies and procedures and privacy policy.
Thanks. That's very helpful. There's a follow-up question to kind of the SMI diagnosis and the definition of SMI. So SAMHSA has a specific definition of what serious mental illness is, but it is, kind of a general definition, right? It's, and I'm going to find that definition and read it to you in a moment. I had it handy and just lost it. But that SAMHSA definition, it's on their website. So that's certainly the starting point. And then you're right, your state path program manual may have additional details about examples of SMI or other guidance around documenting SMI. But the good starting point is that SAMHSA definition. And I'll put that in the chat as well. Alyssa, is there a question that you wanted to cover next?
Let me go back to the one from last week real quickly, because there was a question about if you have a path client enrolled in the street outreach project component and they access shelter, at that point, do you need to exit them from the street outreach component and enroll them into the supportive services component so there's not like an overlapping enrollment issue? And the answer is no. The guidance from the PATH program is that once you enter a client into one of those two project components, they stay in that project component for the duration of their kind of participation in PATH. Even if they move into a residential or an emergency shelter or transitional housing project during that time that they're enrolled in street outreach, they can continue to receive PATH services while they're in that project. So street outreach is not included in the longitudinal systems analysis currently. So you're not going to see anything there with those overlapping enrollments. You may see that overlapping in your system performance measures because there is some street outreaches included in a couple of those metrics, but you would just want to document that as a valid overlapping enrollment when you're going through your data quality checks for that.
Great. Thanks for clarifying that. One more just a kind of verbal sharing about the SMI diagnosis. I know it's bringing up a lot for folks. So it is broader than just kind of those three diagnostic categories I mentioned, and is really focused on whether or not there is a diagnosable mental, behavioral, or emotional disorder that substantially interferes with a person's life and ability to function. So it's not just having a mental health diagnosis, but that it is impacting someone's life and ability to function. And that's the kind of serious piece of that definition. You should be confirming that diagnosis of serious mental illness before you enroll. You should have that documentation because if you enroll them without it, it could be an improper enrollment. And there are auditing procedures and things that go on. So you want to make sure that you are not enrolling anyone who is not eligible. So you can provide outreach activities and contacts prior to that documentation and enrollment, but best practice would be to make sure you have that documentation before that enrollment. All right, going back to the top of this Q&A list. So it's a question about making sure that contacts are showing up in reports. And so this attendee said they feel like they're helping a lot of clients, but the reports aren't able to capture the amount of work they do. And so the question is, do the contacts show up in reports only via add and exit entries, current living or referrals, or notes? Like, how do they make sure those contacts are getting recorded?
Yeah, it's a good question. So contacts are only recorded through the current living situation data element. So if you're adding a client note somewhere else or a case note somewhere else in the client's record, those aren't going to be counted as contacts. You need to go specifically to that current living situation data element and record the contacts there for them to show up in reporting. Referrals are recorded and they're reported on in the report, but they're not necessarily recorded as a contact.
Very helpful. Thanks. Um, okay. Let's see. There's a question about reports and how to get rid of percent on clients that are from before I started. Do we need clarifying information?
I think so. There are a couple questions in the PATH annual report that would include clients who like have an enrollment or an entry into the PATH project prior to the current reporting period. If you're trying to pull the report just for like when you started as a PATH worker. But there's other ones that would be like newly enrolled in this reporting period. So I'm not sure that answers the question. If that person wants to add more detail, that would be helpful.
Okay. Yeah, if you can add any more detail. That was Miss Robertson from PATH in Portsmouth. All right. Someone asked, to be enrolled in the PATH program, does a client have to have Medicaid? No, there's no Medicaid requirement. It will be a question about whether they receive Medicaid or Medicare or other health insurance, whether you helped them to enroll and access healthcare coverage, but they don't have to have Medicaid for PATH. All right. Let's see. There's a question about, well, a specific HMIS vendor, WellSky, updating HMIS, about how some other applications might have a different user friendliness or accessibility. Any comments about, do you have anything to say about a specific
I would
vendor?
just say that as a HUD provider, we are vendor neutral and we support all the vendors. I also, in my role specifically at ICF, we serve as HUD's National HMIS Data Lab. So we have relationships with all of the vendors and ensure that their systems are compliant related to the functionality and the user interface and kind of user experience within those software systems. I think that would either be a recommendation or discussion with your HMIS lead, or if you are the HMIS lead, a discussion with the vendor, because they all have these like roadmaps that they work from to improve upon their systems in different ways. And so I don't know what's on WellSky's kind of roadmap for user interface facelifts or anything, but yeah.
Right. Thanks. All right. There's a question here. It's kind of a follow-up from something we talked about last week about when to enroll someone in either outreach or services projects. And supportive services, excuse me, and based on whether someone is in emergency shelter for a few days at the point of first contact, but is normally living outside, and whether or not you should enroll them in path outreach as opposed to supportive services. And so they received some different instruction about this a few years ago. So wondering really if any additional clarification about whether someone was on the living outside before first contact and when to use the supportive services project.
I also think, or I feel like maybe I felt like the guidance was shifted or maybe clarified a few years ago as well. But the PATH HMIS program manual, so the specific manual that supports PATH, not the broader data dictionary, but the PATH specific one, does say, and I'm quoting this, path projects are not typed within an HMIS by where the client is contacted by the project, but rather by the client's primary place of residence at the point of first contact. So and the example they use is if a street outreach project focuses on outreaching to persons experiencing homelessness who are living on the streets and will collect and enter data under the street outreach path program component. While the path funded worker may find it helpful to contact these clients in places where it is easier to find the client, like health clinics, drop-in centers, or shelter lobbies, the client should still be entered into the street outreach project because the client lives on the street. So that's the example given in the manual. It also goes on to say path projects should use available data to determine the client's primary place of residence when selecting which project component to enter them into. In some instances, a client may be contacted in a project or living situation that is not representative of their place of residence. So it's just like having the conversation, talking with them, seeing if there's other data in HMIS that can support kind of verification of that.
Great. Thank you for that clarification. All right, I'm going to kind of wrap up a couple of extra questions that are coming in about proof of SMI and diagnosis and kind of clarification. So my kind of blanket recommendation is to follow up with your state path contact who may ask for additional clarification from their GPO. But our information and instruction from SAMHSA was that every single PATH client that is enrolled into PATH must have documentation of their diagnosis. So that's the message from SAMHSA that's required. Whether or not your SPC says you have 60 days to get that documentation, et cetera, that is a question to kind of follow up with them and them to follow up with their GPO about whether that kind of specification is acceptable. What we know is that when PATH programs are audited and they're looking for documentation for every PATH enrolled client for their SMI, sometimes that's missing and that's problematic. And so we want to make sure that that doesn't become an issue. So that's the kind of advice. So I would say if you feel like you're getting different information, follow up with your SPC to clarify that. All right. Let me see. So a contact. There's a couple of questions that are coming in kind of related to documenting contacts, reporting on clients in their contact notes. And then someone mentioned contacts being only once a month. Is there anything that you can kind of clarify about how often contacts can be recorded, if there are limitations to that or not, how that works?
There shouldn't be limitations to that because current living situations, contacts should be recorded anytime the path worker interacts with a client. So that could be multiple times a day, honestly, but definitely ideally more than once a month. So current living situation equals contact here when I say that. So it can and probably is recorded more than once a month.
Yeah. Okay. And I'm just going to type that in as well. So we've got it both verbally and in that message. All right. So there's a question that I want to cover that came in last week and also is a very common question during PATH annual reporting. And it's related to question 16 in the PATH annual report, which is specific to the number of PATH enrolled clients that were receiving community mental health services at any point during the reporting year from any funded source. So it's a very inclusive count of PATH enrolled clients. It would include anyone who you referred to community mental health services and that referral was attained. It would include anyone who you, as the PATH provider, provided mental health services to, so that service provision. But it also includes those people who were enrolled in your PATH program, who were already receiving community mental health services from another provider and received those services during the year. The tricky thing about this question is that it is not, there is no ability in HMIS right now to indicate that scenario where a person is enrolled in your program, already receiving community mental health services, does not need a referral, and does not receive those services from you, the PATH provider agency. So those clients need to be tracked separately and added into your PATH annual report in PDX. So you'll have everything else about your PATH clients will be recorded in HMIS. All of that will be reflected in the CSV that you upload. And the manual edit that you will need to make to question 16 is adding in any clients that were receiving community mental health services outside of those parameters that HMIS collects. So we'll have written guidance on this. I will explain it in the PATH annual report training that we do this fall and remind folks about this little caveat. We want to make sure that you all are getting credit for those folks who are already engaged in community mental health services and that they're not left out of your count and they won't be captured in the HMIS report because there isn't a function to kind of record that particular issue. They just wanted to share that note right now to be keeping track of or going back into your records to find those people who that pertains to. It'll be a smaller portion for sure of your PATH clients, but an important number to track and then update in your reporting.
Can I go back to data sharing and visibility? Because there have been a couple more questions that have come up in about that specifically. So just reiterating that there is no national requirement or national standard around how path-specific data is shared or is made visible in HMIS. That is really dependent upon your local privacy policy, and the baseline standard for developing your local HMIS privacy policy is the 2004 Data and Technical Standards. Beyond that, if there are local or state laws, privacy data sharing laws that you need to incorporate into the development of that privacy policy, obviously those should all be considered. But there's no national standard on like, yes, the data that is entered into HMIS for PATH should be shared in the system, or no, it shouldn't. It is really up to local privacy policies. I would also say with that, I would also say that often the data that is collected and entered into HMIS for your PATH program is the only street outreach data that an HMIS has, if not a large percentage of the street outreach data your HMIS has. So there could very well be valid reasons to not share that data in HMIS, but I would just consider like the pros and the cons around that.
Great. Thanks for adding clarification to that one. All right, we have a question kind of going back to the outreach and services decision making. So if a client is homeless, they're in the outreach section, what causes them to be in the services section? So this would be someone who is currently in a housing situation, they're at risk of homelessness, they're still eligible for PATH because of that imminent risk of homelessness, but you're not doing street outreach to someone who is literally homeless. So that would be an example of who might go in the services section. And then Alyssa, I'm going to scroll back up. There were some very HMIS specific questions about guidance for defining generally reside maximum, re-engagement minimums, automatic exit maximums. I see if this question in here, should it be exclusive at the organization, program, COC, or state levels? Can they differ? Can you speak to
I
that?
actually think there was like, and I'm looking at the manual, I thought there was like a state path contact decision tool or something
There is.
somewhere.
Mhm.
And I feel like the definitions of those, there it is. Oh, a PDX account is required, so I can't pull it up right
Oh,
now. But
okay.
I think a lot of those are defined in collaboration with your state path contact. I think we can give general guidelines, but I would definitely want to refer you back to them if they have different or have talked through other guidelines.
Yes, so there is a state path contact HMIS data collection decision tool that your SPCs should have or do have access to. Um, and there's some recommendations in there, but I'll see if I can drop this PDF in the chat. It may test my Zoom capabilities, but we'll try as we keep going. All right. Okay, so I'm gonna, there's a question that came in about we have to have a certain amount of clients enrolled as SMI determined. However, the majority of their county referrals are struggling lifeguard models that are GMH with co-occurring with complex situations where other teams are not able to be warm handed off to right away. Is this understood when we aren't hitting the exact number of SMI enrollees? So what I would say is that I think it's understood there's going to be a lot of outreach contacts with people who are not eligible to be enrolled. And that is kind of recorded and counted as like path activity that you are getting credit for in the path annual report. And so those outreach contacts, the number of individual people you contacted, the number of times that you contacted them, all of that is recorded and counted. And then, the subsequent questions about, how many of those people were then enrolled, how many were not enrolled because either you lost contact with them or they lost contact with you, but they weren't eligible for PATH, and you would indicate that too. So there may be a lot of folks that you are interacting with because you're out there talking to people who are in need on the street. Like that's okay, and you would indicate in the report, exactly why they weren't enrolled because they didn't have that SMI. And there's an opportunity to kind of give a similar explanation like you did here in your question in the comments in PDX. So your SPC and then SAMHSA would also be able to see like that comment, this explanation of why we're encountering so many people who don't meet that path enrollment definition, but they did, receive our kind of outreach and that service. All right. Oh, Alyssa, this question came up last week, and might be a good opportunity to clarify some of the dates that you're doing things in HMIS. So the question is, should PATH's release of information date be the same as the entry date in HMIS? So if you could speak to that, and then also the like the HMIS project opening, the PATH enrollment, all of that, those date of engagement dates.
Yeah, that's a good question. I mean, just to clarify, if you are using an HMIS release of information, that is something that is a locally determined thing. The 2004 data and technical standards do not require that. They require privacy policy, and your privacy policy needs to speak to whether you use a release of information. If you use a release of information, I would say that I would say that it is highly dependent upon the interaction that you have with the client, the interaction that you have with the client. So in a scenario where you encounter somebody in an encampment and you have a 5-minute conversation where they're giving you preliminary information to enter into HMIS, but for whatever reason, it just wasn't an appropriate time to ask them to sign an ROI, then it's not the appropriate time. You could still start that client record in HMIS and either make sure it's not shared or make sure there's no identifiable information included in it. And then as you start to build that relationship with the client, as you are also gathering more data from them, you can approach them with the release of information at a later point as that relationship strengthens. And then it would be dated for the date that you collect that release of information from them. Trying to think if there's another scenario that would help answer that question. I mean, there could also be a scenario where the day that you interact with them and engage with them for the first time is the day that they're like, yes, I want services. Yes, I want to engage with you. Yes, I'm willing to answer all your questions. And then you can collect the ROI at that point, and it would be dated for the date of entry. But the date of the project start date would be that first contact date. That may not be the enrollment date or the date of past status determination, right? We talked about that last week. So I think the ROI is just kind of when it's dated and when you actually get that sign from a client is going to be highly dependent on how that relationship goes over time.
Great, thank you. All right, this question is, should path providers work alongside other street outreach teams that have SSO funding to assist verifying clients as homeless, or can path providers verify clients as homeless on their own? So path providers can do that verification on their own. So either from their observation or client self-report, that homelessness verification, living situation status can be verified by you. It's the SMI diagnosis that needs documentation from an acceptable source. Oh, we did this one. Let's see. All right, this is another HMIS question. So in their county, they're not able to complete a CLS unless they open them in the project. Then once eligibility is determined, they either keep the client in the project or exit them. This is how I ensure the work I complete while rapport is being built and eligibility is accurately encoded or recorded, excuse me. Is this acceptable, or will I need to speak with HMIS leads?
Yeah, I'm like thinking through the workflow, right? So when I would go into HMIS, I would create the client record first, which, if they don't give you their name initially, you can enter them under some kind of alias that you can recognize to circle back to later to fill in as you get more information from them. I know we use the like Red Hat 10th Street Bridge often, but maybe it's girl with the dragon tattoo or something that is like more permanent that you can definitely know and circle back to fill in more accurate information over time. But I would create that client record first with whatever information I have. And then I would go and create a project start date. So project start date of if I encountered the client for the first time on August 1st, my project start date would be dated for August 1st. That project start date then within there has assessment information, and the current living situation should be within that assessment. So it makes sense to me that you wouldn't be able to add a current living situation for a client unless they have a project start date. And if you could record a current living situation outside of a project start date, it wouldn't show up on the report anyways, because you have to otherwise it's this like floating data element that isn't anchored to anything. So it wouldn't show up. So you would have to have the current living situation within a project start date. So yeah, that makes sense to me. I think I'm answering that question.
All right, thanks. Yeah, I think that was really helpful. And if ask that question, if you have follow-ups, feel free to add in additional ones. All right, so this is done. Okay. All right. I was trying to go back and forth between us, but I may have just a few for you in a row. The question from Richard is there a way in the future to combine sub-assessment notes with regular client notes in HMIS? Do the sub-assessment notes back up in the services in a more concise way? So they're kind of talking about how they do client notes, add in different services listed in them, copying and pasting into sub-assessment, just questions about that.
Yeah, this is a very vendor specific language, and I know exactly which software you're talking about. When you say sub-assessment and client notes and whatnot, that is a system functionality. Um, that is a system functionality. So I would definitely, if you are not the HMIS lead, talk with your HMIS lead about that. If you are the HMIS lead, connect with the vendor to see if there's a way to either auto-populate things or update that functionality so you're not having to copy paste or duplicate work. Because the last thing we want is you to have to spend more time on data collection and entry. We want you to spend more time with the people you're serving. So
Great, thanks. All right, there's another question about kind of documentation about serious mental illness, whether or not, someone doesn't seek treatment, don't get that, if they don't get that confirmed diagnosis, what do you do? I think one thing you can do also is just to kind of speak to this about someone who, might not be ready for engaging in kind of current mental health services. If you can find historical records, right? So if you can find, past medical records from a hospitalization or something like that, I think you can use that. Or if there are records that were used in a former disability application, or there are other ways to kind of get that diagnosis. Documentation other than kind of a current assessment or current engagement in treatment. But again, I do think this would be an important thing to follow up with your state path contact about how exactly they want you to follow through with that, whether they want you to, you know, proactively enroll someone and then get the documentation or not enroll them until it and exit them. So, because if you're enrolling them, you should have that confirmed diagnosis. So it's kind of a tricky thing, but I think consulting with your state path contact is the best bet to make sure that you will have the documentation that they will need, that SAMHSA will need when they're doing that audit. All right. All right. There's a clarification question about this generally reside maximum. From the PATH program HMIS manual, PATH funded workers are required to ask clients, where did you sleep last night? Program a client is entered. In this section, it suggests only using where did you sleep last night to determine which project type to use. So if you have any additional comments on.
yeah, I also see that up on page 11 where it says path providers should use the following data collection methodology to determine which project the client is then entered into at first contact. And it is the where did you stay last night? Because all of this information is based on the 3.917 data set or the approximate date this episode of homelessness started, prior living situation, so on and so forth. So, I don't know, Kristen, we may want to connect with you to see if we need to clarify, update this language. I think in general, we ask like, where did you sleep last night to get at the prior living situation data element in HMIS. If we need to add additional context around the generally reside specifically for the PATH program, we should connect on that and do that.
Okay. Sounds good. All right. Thanks, Paula. We're going to improve clarification for everyone. All right. Okay, I'm going to take this. Oh, now I've lost it. I scrolled past. Okay. So regarding question 16, does community mental health refer specifically to a community mental health center by federal guidelines, or is it more broadly to receiving any mental health services within the community? So it is a more broad definition. So it is not like a specific federally defined service, community mental health service or something like that. Yes, it is more broad. And there's specific definitions in the Path Annual Report manual, and I'll look for that language to provide that specifically. While I do that, Alyssa, do you have a question that you see that you want to tackle next?
There was the, hold on, still a few more visibility ones. I think we're good on that. There was this one about active clients. So this question is about active clients on the path report. It was mentioned last week that a few dates could qualify a client as active. Would a project start date in the report period qualify a client as active, even if no current living situation or other date was present? And I was trying to dig into that as you were talking. And from what I can see, no, but I don't know. I can't think of a valid scenario where you would have a project start date without a contact on that same day. Because why else would you create a project start date for a client if you hadn't also contacted them? But from the specs I'm reading, you have the date is always tied into the active status. So the date has to be less than the report end date, greater than or equal to the project start date, greater than or equal to the report start date, and less than or equal to the project exit date. So it is compared to the project start date, but that means that the date has to be one of a contact, a date of engagement, a past status, or services.
All right. The next question, I've been meaning to get back to this one. Sorry, you had to wait so long for it. The question was whether it's a best practice to save diagnosis documentation either in their HMIS vendor system or their agency's EHR system. So I'll speak to the kind of path program side and your EHR. You should definitely have it saved in your regular client record. So where you are saving that documentation, any documentation that you would have related to what you're providing, have it there. I'll ask Alyssa to weigh in on whether or not you would put that in HMIS as well.
You can. You can. I would definitely make sure that it is accounted for in your privacy policy. But we also have, I mean, I know communities that use HMIS to upload like ID cards and birth certificates and SSN cards just because it's a like a virtual wallet for a client because they don't necessarily have a real one to keep their real documents in. So I see value there, but I would also want to make sure that your documents that you have uploaded in HMIS are covered explicitly in your privacy policy.
Great, thank you. All right, we have a question about what an HMIS admin can do to monitor these agency types specifically internally.
Every HMIS should have the functionality to run an audit log or an audit report. The details of what's included in that audit report are going to be specific to each software system, and how you run that audit report is specific to each software system. But I would think about that. And then if you're also talking about monitoring for like data quality, I would say that each vendor also has different data quality tools and resources available for an admin to be able to run and support the agency in addressing data quality issues. So if you're thinking more from a audit perspective, who is accessing the records, who is accessing the projects, who's entering the data, audit log. But if you're thinking more on data quality monitoring, data quality.
Great, thanks. This next question is about tracking forms for outreach contacts, whether they should develop their own. I thought should be going into HMIS as well. So I did want to speak to that a little bit, and then I know, Alyssa, you had kind of an answer to this question as well about development of either tracking forms, assessment forms, intake forms that you might use during outreach, and then kind of take back to your desk to enter into HMIS. So this is often something that's locally developed. And Alyssa, do you want to speak to what that looked like in your experience? And there's definitely examples of these forms out there from in different communities.
Yeah, I would just reiterate that outreach context equals current living situation. So regardless of how it gets into HMIS, it should be in HMIS. It should be recording HMIS, whether you're pulling up your software live time on your phone or tablet and entering it that way, or collecting it on paper and entering it in later. There are definitely examples of how to collect it on paper and enter it in to the system afterwards. But either way, they have to find their way into HMIS eventually.
Okay, thanks. All right, there's another question here about when you're working on a client's case, so doing work that is not a face-to-face or direct interaction, how do they record that time if the CLS requires an immediate interaction? So how do they report the services if there's not a CLS to accompany it?
I mean, that type of information isn't going to show up on the PATH annual report, and I don't know to what degree SAMHSA needs that information. But if you are interested about understanding that locally or within your own agency, I would, I mean, work with your HMIS lead to figure out if there's a way to collect that information in HMIS or find a way to keep track of that information somewhere else. But I could see a way. I mean, as a previous HMIS lead, I could see a way that you could use HMIS to capture that information. It won't show up in your PATH annual report because it's not one of the pieces.
Thanks. Yeah, all right. Okay. This might be a kind of a philosophical question. It's wondering if we know why we identify PATH clients living in shelters as supportive versus street outreach, but coordinated entry counts them as literally homeless and classifies them as street outreach. Do you know the history on that
I mean,
distinction?
coordinated entry, I mean, sorry, words. Um, Emergency shelter and street outreach prior living situations are both in the homeless situations category, but they are distinctly different types of homeless situations in the HMIS data standards. If your coordinated entry is categorizing people in shelter as unsheltered, that's a local thing. Like I can't speak to that.
All right. So there's a question about SOAR referrals and the fact that SOAR is not currently a question that's required in the PATH annual report or reported out in the PATH annual report. What I would say, and so it's about, they have folks who were certified, moving on, replacing them, the challenges with this. What is still requested and reported is connection to income sources and SSI and SSDI. So if you have someone who's using the SOAR model or using other models of benefits application assistance, you definitely want to provide that service. It's important, but also tracking it and reporting it in that part of the report. So even though that specific SOAR connection question isn't applicable right now, it is important still to do those functions, and you can, report and get credit for those functions. Let's see. Someone's just sharing best practice that I'll verbalize for others if you all aren't reading the questions. Their PATH team has a printable HMIS ID, and they've found that it's been useful at some of the DMV MVDs as a form of identification. Other DMVs have incorporated affidavits of identity, which has also been quite useful in obtaining client IDs. So anyway, just a tip of another ID, or folks are using their HMIS to help with that. All right. This is a question about, or comment/question. Some PATH programs are uploading their case management notes into HMIS as well as other scanned items. Is that okay?
Yeah, I think that's fine. Again, it's often I think of HMIS as a system of record, and what you include in that system of record is behind like a very um, secured system. So I mean, I think it's fine. Again, would want to make sure that your privacy policy and your HMIS P&Ps cover those kind of uploads and how they're shared and who they're shared with, but I don't see an issue with that.
Okay. All right. I put it in one of the questions as an answer, but I'll put it in the chat as well. If there are questions that come up, if you have additional questions after the office hours or really specific questions that you want help with, you can email us pathpdx@prainc.com, and I will either get Alyssa's help with answering you or talk with Samsa or look up references and things. So we can definitely dig in more about anything that we don't get to today, because we are coming up in our last few minutes. All right, so there's a question. If a client calls more than once a day, do we record each time, or is once daily sufficient?
I'd be curious your thoughts on that, Kristen. I don't know that I would need to look at I'm looking at the specs right now to see if that's beneficial at all, or if it would.
So I feel like in the at the top of the report, where you are looking at the number of contacts, so you have the individual number of people that you've contacted and then the number of contacts, it would increase that number if you were recording every single contact before enrollment. So I think that's where it would show up in the data if that was prior to enrollment. I would say, if you are having, an interaction with them each time they call, if they, call you 4 times and leave a message, no. But if you're, interacting with them, engaging with them, yeah, that would count as a contact.
And it's I feel like it's a best practice when you're an outreach worker to not have like different standards for different things. So for saying like record every contact, right, every time you connect with a client, except for if it's on the same day, that just we don't need those kind of qualifiers. I would, and there could be a scenario where you find that the client's current living situation changed within the same day, and then you would definitely want to record. So I would just say yes, record them all.
Yeah. All right. All right. I think you got that. Okay. There's a few questions that are specific to just kind of path program operations and not necessarily data and reporting. And so I'm going to encourage you all to, you can reach out to me and we can connect offline about like what kind of path program time you're allowed to spend with someone, and whether or not you can use, path funding to spend that time if they might not be enrolled, things like that. So we can take that offline, and to your SPC too is a great resource for determining how you spend your path grant funds on staff time. All right, here we go. All right. Elisa, did you have any other questions from the spreadsheet or from, I guess, last week's webinar that you wanted to make sure we covered?
I don't think so. There were some really good questions that came in, and I know we answered quite a few last week, some additional ones that came in today. But I mean, there are a lot of good resources available to you as you're collecting the information and the data standards dictionary and the path HMIS manual and the path reporting specifications, and then the resources on the PDX and the PDX library as well. And I know Kristen linked the PDX email address. You can also always submit an AAQ as well. And if I need to connect with Kristen to answer the question, then I will too. So multiple avenues of support for you as you keep on this journey.
Well, there's a question about a text thread counting as a contact.
I'd be curious about your thoughts on that. I think it like kind of how in depth the text.
Yeah. And I actually might want to check and follow up with you if you could send me an email to see whether or not that would count. I definitely think, it is part of engagement, right? And it is part of engagement in the modern world. How that gets documented, I think is maybe a question that I would want to clarify. Yeah. Okay. I think just asking if there are any other questions from folks. I think we've covered a lot today. Thank you so much, Alyssa, for your expertise. So helpful. Thank you to our captioner, Ellen, our ASL interpreters, Pamela and Dave, our Spanish interpreters, Tamara and Enrique. We really appreciate you making this accessible. Please, anyone who had a question that we didn't get to or needs just a little bit more time and response, we definitely want to be responsive. So send us an email and we will get back to you with official answers. And thanks, everyone. Look forward to connecting with you as the PATH annual reporting season opens up this fall. We'll see you again soon. Thanks, everyone.
Thank you.